Hi, I am Jolly Thomas, and I will be performing a physical examination on Tina Jones, who is a 28-year-old African American female who presents to the clinic for a complete physical assessment, which she needs for a pre-employment physical. Tina Jones is alert and oriented, appears to be in no apparent distress, is sitting comfortably on the examination table, and she denies any current illnesses or concerns. I will begin by first inspecting her head. Her head appears normocephalic, atraumatic, with even distribution of hair and no obvious signs of lesions or masses. This time I also take a look at her eyebrows and her eyelids, and it has equal distribution of hair. Next, I will examine both her eyes. The right eye, the sclera is white, no redness or drainage noted in the right eye. The left eye is also, the sclera is white, no erythema or redness noted in the eye. Next, I will examine her eyelids. I will palpate the upper eyelids. There's no ptosis or edema observed in the upper eyelids. Similarly, in the lower eyelids, there's no edema. The conjunctiva is pink, moist, with no drainage. Next, I will examine both her pupils using a pen light. We'll start with the right eye. Next, I'll examine the left eye. So both the pupils are equal, round, reactive to light and accommodation. Next, I will be assessing her peripheral vision. Tell me when you can no longer see my fingers.
Okay, I will. Now.
Her peripheral vision is intact. Next, I will assess for her eye movements. Follow my fingers with just your eyes. Follow my fingers with just your eyes.
Okay.
So I tested her extraocular movements, and there was full range of movement, and there was no nystagmus, and I was also able to test convergence. I will inspect both her ears. Her outer ear, there does not seem to be any obvious abnormalities, no discharge from her ears, but I do observe some pustules from acne on her face and some unequal and some excessive hair growth on her face. And now I'm looking at the right outer ear. There seems to be no obvious abnormalities, no drainage from the ear, but I do also note some acne and excessive hair growth on her face. I will palpate for the cervical lymph nodes next. So I palpated the neck lymph nodes, and there were no palpable lymph nodes detected. Next, I will palpate the supraclavicular lymph nodes, and none detected. Next, I'll palpate the TMJ joint. Open and close your mouth. So I palpated the jaw, and there's no clicks, and there's full range of motion. Next, I will inspect her mouth and throat. The oral mucosa appears pink and moist, but both her tonsils are 2+ and no redness noted. Her dentition looks normal with no caries or infections. Now I will depress her tongue. And the uvula rises midline with phonation. She will pull up her tongue. Push the tongue to the left. Push the tongue to the right. And there's no signs of any ulcers or lesions in the mouth. Then I'll text her gag reflex, and it's intact. Next, I will assess her visual acuity. Tina Jones did report that her vision has improved with corrective lenses that she's using currently. I will first ask her to cover her left eye and start reading.
FP TOZ LPED PECFD EDFCZP FELOPZD DEFPOTEC.
Okay, now we will cover the right eye. Well, let me just check once more.
I can't read that line. It's too little.
Okay, so now we will cover the right eye.
FP TOZ LPED PECFD EDFCZP FELOPZD DEFPOTEC. I can't read that line. It's too little.
So an assessment of her visual acuity, her vision is 20/20 in both eyes. Next, I'll examine her fundus with an ophthalmoscope. First, I will examine the right eye. Everything looks okay there. So the right eye, I do see some mild retinal changes, and there is some cotton wool bodies present. And I'll examine the left eye. So the left eye, the disc margin is sharp, and no retinal changes and no hemorrhages noted. Next, I will examine her ears and nose using an otoscope. I'll begin with the right ear. So the examination of the right inner ear shows no redness. The tympanic membrane is intact and pearly gray. The cone of light is at 5 o'clock and no drainage or cerumen noted. Next, I will examine her left ear, and the left ear also does not show any redness. Tympanic membrane is intact. Pearly gray, cone of light is at 7, and no drainage or cerumen noted. Next, I'll examine her right nostrils. The mucosa is pink and moist, midline septum, and no drainage. Left nostril also is pink and moist, midline septum, and no drainage noted. Next, I will inspect her abdomen. So her abdomen does appear protuberant, and there is it is symmetrical, and we do see some excessive hair growth from the pubis to the umbilicus, and some stria noted. Next, I will auscultate the abdomen for bowel sounds. I will begin in the right lower quadrant. So auscultation for bowel sounds is normoactive in all 4 quadrants. Next, I will percuss her abdomen, beginning with the right lower quadrant. Percussion of the abdomen is tympanic in all 4 quadrants, and no dullness noted over the spleen. Next, I will percuss for the liver span. So the liver span is 7 centimeters mid-costal line, mid-clavicular line on percussion. Now I will palpate the abdomen using a light touch, beginning with the right lower quadrant. And palpation of all four quadrant using light touch revealed it to be soft and no masses. Now I will palpate the abdomen using deep palpation, beginning with the right lower quadrant. Deep palpation of the abdomen reveals no guarding, no tenderness, and no masses in all four quadrants. Next, I will palpate for the organs, beginning with the liver. So the liver is palpable 1 centimeter below the right costal margin. Palpated for the spleen and it is not palpable. I palpated for the left kidney and it is not palpable and no mass is detected. Palpated for the right kidney, it is not palpable and no mass is detected. Next, I will assess the CV8 for CV8 tenderness. I will percuss the right kidney. No tenderness reported. Percuss the left kidney and no tenderness reported. Next, I will inspect Tina Jones' legs for any edema. And examination of the bilateral lower extremities reveal no edema. I will palpate the peripheral pulses in her lower extremity, beginning with the right femoral pulse. Right femoral pulse is 2+. Left femoral pulse is 2+. Left popliteal pulse is 2+. Right popliteal pulse is also 2+. Right tibial pulse is 2+. Left tibial pulse is 2+. Left dorsalis pedis is 2+. And right dorsalis pedis is also 2+. Next, I will inspect her toenails. Her toenails, there's no change in color noted, no ridges and no abnormalities. Next, I will assess for capillary refill in her toes. I will test her right pinky toe. The capillary refill in the right toes are less than 3 seconds. Now I will examine the left toes. So the capillary refill in the left toes are also less than 3 seconds. Palpate the peripheral pulses in her upper extremities, beginning with the right brachial pulse. Right brachial pulse is 2+. Right radial pulse is 2+. Left brachial pulse is 2+. And left radial pulse is also 2+. Next, I will assess for capillary refill in her fingers, beginning with the right pinky finger. All right, the capillary refill in the right fingers are less than 3 seconds. Now I will check the left fingers. All right, so the capillary refill in the left fingers are also less than 3 seconds. Now I will inspect her fingernails. Her fingernails look normal with no discoloration, no ridges, and no abnormalities. Next, I'll palpate her carotids. I will check the right carotid pulse. And the right carotid pulse is 2+ with no thrill. And the left carotid is also 2+ with no thrill. Next, I will palpate for PMI. Palpated anterior chest, PMI is non-displaced, no heaves or lifts noted. Next, I will auscultate her carotid. Auscultated the right carotid and no bruit. Auscultated the left carotid artery and no bruit noted. Next, I will auscultate the abdominal arteries, beginning with the aorta. No bruit noted. We'll auscultate the left renal artery. No bruit noted. Auscultated the right renal artery. No bruit noted. Auscultated the right iliac artery. No bruit noted. Auscultated the left iliac artery. No bruit. Auscultated the left femoral artery and no bruit noted. Auscultated the right femoral artery and no bruit noted. Next, I will auscultate the cardiac points. So I auscultated the cardiac points. The heart rate appears to be regular. S1, S2 present. No murmurs, no rubs, and no gallops noted. I will percuss her anterior chest, beginning in the upper right chest. So percussion of the anterior chest wall is resonant in all fields. Next, I will auscultate the anterior chest wall for her breath sounds.
Normal. 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 Normal.
So auscultation of the anterior chest reveals breath sounds equal bilaterally and no adventitious sounds noted. Next, I will palpate for symmetry and expansion on the posterior chest wall. Palpated the thoracic expansion and it is symmetric. Next, I will palpate for tactile fremitus in the anterior chest.
99, 99,
So fremitus is equal bilaterally in all quadrants of the anterior chest. Next, I will percuss her posterior chest, beginning in the upper left back. So percussion in the posterior chest wall shows resonance in all areas of the chest. I'll palpate for tactile fremitus in the posterior chest.
99, 99, 99,
So palpated the fremitus and it is equal bilaterally in all areas of the posterior chest wall. Next, I'll auscultate the posterior chest. So auscultation of the posterior chest reveals breath sounds equal bilaterally with no adventitious sounds. Next, I will assess her motor skills. I will ask her to close her eyes and touch your fingers to your nose. Close your eyes and touch your fingers to your nose.
I can do that.
So the movement from finger to nose for both the hands were smooth. Next, I will assess for motor skills from heel to shin movement. Run your right foot down your shin.
Sure.
Run your left foot down your right shin.
Okay.
So she was able to move her heels to shin and bilateral legs with no deviation. Next, I will assess for sensation and respond to sensation in her lower extremities. Close your eyes and tell me if the touch is sharp, dull, or soft.
Okay.
I'll begin with the dull sensation.
Dull. 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 Soft. 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 Soft.
Now I will test for the sharp sensation.
Sharp. 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 Sharp.
So she is able to feel sensation in her lower extremities to dull, soft, and sharp sensation. Next, I will assess for position sensation of her fingers. Close your eyes and tell me if your fingers move up or down.
Okay, I will.
We'll begin by testing the left hand.
Up. Down.
So position sensation in the left and right hand is intact. Close your eyes and tell me if the touch is sharp, dull, or soft. So I will be assessing for sensation in the upper extremity, beginning with dull touch.
Dull. 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 Dull.
And I'll also examine her chest for sensation.
Dull. Soft. 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 Soft.
So sensation in her upper extremity and chest is intact. Close your eyes and tell me if the touch is sharp, dull, or soft. Close your eyes and tell me if the touch is sharp, dull, or soft.
Okay. Sharp. 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 Sharp.
So sensation to sharp touch is also intact in the upper extremities and chest. Next, I will assess for position sense in her toes. Close your eyes and say if your toes move up or down.
Okay, I will.
We'll begin with her left foot.
Down.
Now we'll examine her right foot.
I think that was.
So position sense in her left foot is intact, but the position sense in her right foot is decreased. Now I will use the monofilament test to examine sensation in the plantar surface of her feet. Close your eyes and tell me when you feel the touch.
Okay, I will.
So we will begin with the right great toe. She does not feel sensation in the right great toe.
Yes.
She does feel sensation on the right foretoe under the great toe. And she does not feel the sensation in the right forefoot under the small toe.
Yes.
She does feel sensation on the right bottom. I will go to the left foot. She does not feel sensation on the left great toe. She does not feel sensation on the left forefoot under the great toe. She does not feel the sensation on the left forefoot under the small toe.
Yes.
And she does feel the sensation in the left bottom. So the monofilament test reveals that she has decreased sensation bilateral plantar surface of the feet. Next, I will check for deep tendon reflexes in the upper extremities, beginning with the right arm. So the right triceps, biceps, and the brachioradialis are 2+. Now I will examine the left upper arm. So the left tricep, left bicep, and the left brachioradialis is all 2+. Next, I will test for the deep tendon reflexes in her lower extremities, beginning with the right patellar reflex, left patellar reflex, left Achilles reflex, and the right Achilles reflex. So the test reveals a deep tendon reflex in the left and right knee and ankle are 2+. Next, I will test for graphesthesia. Close your eyes and tell me what I trace on your palm.
Okay.
Begin with the left hand.
That's an A. A figure.
So the graphesthesia test in the left hand and the right hand is normal. Next, I will test for sterognosis. Close your eyes and tell me what I put in your hand.
Okay, sure.
Begin with the left hand.
That feels like a key. This is some wire thing. Paper? Some kind of coin.
Next, we'll test the right hand.
That feels like a key. The paperclip again. Some kind of coin.
So test for sterognosis in both the right and left hand is normal. Next, I'll assess for shoulder strength. So she pushes both her shoulders against my hand, and the strength is 5 out of 5. Next, I will assess for range of motion of her neck. So she's able to extend her neck. We'll next check for flexion. Next, we will check for lateral bending. So she has full range of motion in her neck. Next, I'll assess for range of motion in her wrists. She's able to perform adduction and abduction of both the wrist. She's able to extend both the wrist. And so she's able to also flex both her wrist. So she has full range of motion in bilateral wrist. Next, I'll assess for range of motion in her ankles. So she has full range of motion in bilateral ankles. Next, I'll assess for hip strength. So tested right and left hip, the strength is 5 out of 5. Next, I will assess her hand strength. So hand strength in the right and left hand is 5 out of 5. Next, I will assess her ankle strength. So bilateral ankle strength is also 5 out of 5. And finally, I will inspect her skin and general inspection. So on inspection of her face, as noted earlier, she has some pustules from the acne and excessive hair growth on the face. Even distribution of hair. And on her neck, we do notice some hyperpigmentation all around her neck. Inspection of both the arms, nothing abnormal detected. So also her hands. So as we noted earlier, her abdomen does have hair growth from the pubis to the umbilicus, and it's protuberant. And both her knees, no swelling, no redness noted. So also her ankles, nothing abnormal detected in the skin. So that brings us to the end of the physical examination of Tina Jones, and nothing abnormal was detected except for decreased sensation with the monofilament test and the bilateral plantar surface of her feet. Thank you.